Hi, I'm Dr. Patty Barch, and this is a science update. I'm hoping to provide you with some information that might explain why you or someone you care about is having certain experiences. First, a little bit about my credentials. I'm currently a traditional naturopath. I have 5 degrees in a scientific discipline, and I have a background in biotechnology and drug development. I am listed as an author on multiple scientific publications, and I have extensive training in immunohistochemistry. So the information presented here is for educational purposes only and is not intended to diagnose, treat, cure, or prescribe for any disease or condition. Apparently, the list of sources that you can get medical information from include your medical professional, the government, your employer, and Facebook fact checkers. So listen to those people, and this is just for your entertainment. So first of all, I want to talk about the injections. So what a lot of people don't realize is shortly before the injections hit the market, the regulatory agencies literally changed their definition of the word vaccine. At the time, the definition, the new definition was more broad and included what is really gene therapy. And I'll explain that in a minute. But one of the reasons, there's basically 2 primary reasons why they would change the definition of the word vaccine. One is people are comfortable and used to the word vaccine, and many people trust anything that is labeled vaccine. So to put that label on it, rather than call it gene therapy, which most people have never had in their life, was going to improve compliance, right? People think they know what they're getting because they are familiar with the term vaccine, but the definition had changed. The second reason to change the definition is vaccines have a different path through the approval process with the FDA than gene therapy does. So if they change the definition of vaccine, more products that would have gone through the gene therapy pathway of approval or authorization were now going through a vaccine pathway instead. So I want to read you the definition of gene therapy, and then I'm going to explain a little bit about the injections and what they do. So human gene therapy seeks to modify or manipulate the expression of a gene or to alter the biological properties of living cells for therapeutic use. So let's talk about these vaccines, specifically the ones that have the messenger RNA in them. So first of all, messenger RNA in nature is a very unstable molecule. It has a half-life of about 20 minutes. The developers of these injections knew that was a very unstable molecule, so they had to manipulate the molecule in a way to make it more stable. RNA has just a limited amount, like 4 nucleic acids that comprise its alphabet. Uracil is the naturally occurring nucleic acid that is included in the mRNA. What the developers of these injections did was when they recreated the gene sequence that was being injected into people to inspire their cells to manufacture a protein, they changed the uracil. They took out uracil because this is made in a laboratory. So they took out the uracil and they inserted in its place something called pseudouridine, which is a much more stable molecule. So they went from a 20-minute half-life to a currently unknown half-life. So in fact, there's been a Freedom of Information request to get the Pfizer clinical data from the FDA, and it's being released over a period of 8 months. And so it's been trickling out, and some of the data that has come out included a biodistribution study. So originally, people were told that they would get an injection in their muscle and that substance would stay in the muscle and that it would make a little bit of this spike protein, and then the body would learn to make antibodies against that spike protein, and then you'd be like protected and you couldn't spread it and all this stuff. Well, that's not what happened. So what happened was, because they use these lipid nanoparticles, including polyethylene glycol, which is known to cross membranes. It crosses cell membranes, but it also crosses other membranes, including the blood-brain barrier. So these injections contain the lipid nanoparticle, which is like the little vehicle that is holding on to this messenger RNA. The messenger RNA's job is to teach your DNA the recipe for making a protein, and in this case, it's the spike protein. So they put this substance into your muscle, and it didn't stay there. Biodistribution Study said it right away went to other tissues with high accumulations in the ovaries, and I believe the spleen and bone marrow, and adrenal glands, I think. But I know the ovaries were like the highest on the list, or one of the highest on the list. So what happens is they inject your arm with this substance containing the lipid nanoparticle. Within the lipid nanoparticle is the recipe for the spike protein. Because it doesn't stay in your body, because it goes all throughout your body, it can, and it has that like secret password to get into any cell or tissue. They are finding that different cells in the body are taking up this recipe and they're cranking out the spike protein. So the studies that have been done for, well, how long do these cells make spike protein? Well, those studies were terminated at 60 days. And as of 60 days, they were still making spike protein. But what they don't know is a year later, 2 years later, are your cells still manufacturing this spike protein? Now, why could that be a bad thing? Well, the spike protein is a highly inflammatory molecule. So it causes different types of inflammation in the body. Also, your body makes antibodies against the spike protein, and there's something called molecular mimicry, where your body confuses your own cells and tissues for the spike protein because they're very similar genetically. They have some similar, say, words within the sentence. And so your body starts to make antibodies against that. I have a hypothesis that wherever you have the most inflammation in your body, you're most likely to have negative impacts or potential autoimmune results, because when there's inflammation there, there's more blood flow going there. And so if this substance is traveling through your blood and you have an inflamed tissue or organ like your pancreas, maybe you just ovulated, so your ovary is inflamed, maybe you have brain inflammation, maybe you already have an autoimmune disease and so you have some intestinal inflammation. Whatever the case may be, I always feel like it's the weakest link that is impacted the strongest from this injection. So I wanted to just circle back. So remember, they put this substance into your body. This substance carries a recipe to teach your cells to make the spike protein. And it does that by getting into your genetic material and turning on a switch so that your body has the recipe to make the spike protein. So reiterating the definition of gene therapy. Human gene therapy seeks to modify or manipulate the expression of a gene. Expression of a gene means the protein that it makes, to alter the biological properties of living cells for therapeutic use. So based on this definition, those injections clearly meet the parameters for gene therapy and not the former definition of vaccine. So we're going down the gene therapy rabbit hole now. So this is an FDA document, long-term follow-up after administration of human gene therapy products. So this was produced by the FDA in January of 2020. You know, a few weeks after COVID-19 hit the world. So I highlighted just a few things. It's a 38-page document, so I highlighted just a few things to bring to your attention. So this is guidance for the industry. So for companies who are manufacturing gene therapy products to bring to the FDA for approval or authorization, the FDA is giving them this guidance for what they need to make sure is done for approval of their gene therapy products. So just a couple of things. Collection of data on delayed adverse events following administration of a gene therapy product. As a result, long-term exposure to an investigational gene therapy product, study subjects may be at increased risk of undesirable and unpredictable outcomes that may present as delayed adverse events. On page 4 of this document, they talk about how long should these studies go on. The agency, meaning the FDA, the agency advised sponsors are the pharmaceutical companies, to observe subjects for delayed adverse events for as long as 15 years following exposure to the investigational gene therapy product, specifying that long-term follow-up observation should include a minimum of 5 years of annual examinations, followed by 10 years of annual queries to study subjects either in person or by questionnaire. So you see why they didn't call it gene therapy products? Okay, so couple more things on that. So why are people suddenly having a lot of problems that they didn't have before their exposure to this intervention? Well, as I mentioned, the spike protein is a problem, and if your cells decided, there is something called reverse transcription. So we were also told that there's no way that this mRNA can get into your DNA permanently. There have already been at least 2 published studies debunking that, where they identified the fact that there's something called reverse transcription, where the DNA takes up that genetic code and intercalates it into the genetic sequence of the cell, and it's there permanently. So because we haven't had 15 years of follow-up studies, we don't know if that is happening, but there's evidence to indicate that it might be. So some of the things that are happening that are of legitimate concern are suppression of the immune system. So the thymus, which is part of the immune system, it makes T cells, helper T cells, and those are patrol cells that are very important for fighting off cancer and fighting off other viruses. You may have heard that a lot of people, like the more injections that they receive, the more they're catching different diseases, right? They're having shingles outbreaks, they're catching colds, they're not getting it over their colds, right? There are a lot of issues there, and they've had the specific virus multiple times. There are definitely some reproductive factors involved here. There's a protein that is called syncytin that is molecularly similar to the spike protein. It's similar enough that the body can confuse them. And again, we've trained the body to make antibodies against the spike protein, but they actually can fit on this syncytin protein, which is important for reproduction and placental integrity. There's a lot going on in that wheelhouse as well. So I'm not going to get into all of the things in this video that people need to be doing to rescue their body from this gene therapy that has not been effectively monitored for any length of time. there are some really great resources that are exposing some of the effects or impacts of these, but it's going to be at least 15 years before we actually know. Some of the reproductive toxicology studies that have come out are concerning. There's a specific rat study where the babies of the rat who got the injection seemed fine, but their babies had skeletal malformations. So their bones didn't develop appropriately. And it's way too soon to say if this intervention is going to be like some of the other things like thalidomide or DES that were given to pregnant women and impacted their offspring or potentially the offspring of those offspring. Okay, so I know it's a ton of information. I just wanted to kind of bring to your attention some of the science here and why we're starting to see some really discouraging things bubbling to the surface about health outcomes after this intervention has happened. In clinical research, an experimental product is supposed to be considered guilty until proven innocent. Any new symptom that arises after the intervention is assumed to have been caused by the intervention and can only be discounted once that's proven. We have a lot of people who their symptoms have developed since they got that intervention. I had a gentleman come in about 40 years old, extreme fatigue. I think he had at least 2, if not 3, recent diagnoses of autoimmune disease and had multiple interventions. So there's a lot coming, there's a lot coming down the road here, and I just want you to know that it's logical that this is happening and that there are practitioners across the globe who are figuring some things out about how to restore the body back to balance after these types of interventions or even exposure to the organism itself and then not being able to clear that. So I've been following a lot of these practitioners. I've been trying different things with clients in my practice, and thankfully we're starting to find some things that seem to be beneficial. The sad thing is that a lot of people are being diagnosed with late stage cancer. Like all of a sudden they have stage 4 ovarian cancer or other different types of cancers that it's stage 4. That means it's already spread throughout the body. So anyway, that's your science lesson for today. Please feel free to like and subscribe to this channel. Click the bell if you think that this is the type of information that you'd like more of. And, follow me on Facebook. And I do try to get some of these videos on Rumble and stuff too, in case they don't make the cut here. All right. Peace out, peeps. Have a healthy day.